May is National Skin Cancer Awareness Month. There are some things doctors say you can do to stay safe as we head into summer. Isabella Moody has the story.
The SunSafe team from the Georgia Cancer Center teamed up with Impact Melanoma, Augusta Canal Authority, and Unite in the Fight Against Cancer to install and maintain 5 sunscreen dispenser stations for public use. The first sunscreen dispenser was unveiled this week at Enterprise Mill.
This project is one of these elements of our community outreach, our prevention, to try to help the community decrease the risk of developing cancer.
Sunscreen is one way to combat the sun, but experts say you should also avoid midday sun and wear hats and sun protective clothing.
You want to use SPF 30 or higher. We really like physical blockers, so those sunscreens that have zinc or titanium oxide are great, and then reapplying frequently.
The most diagnosed cancer in the U.S. is basal cell carcinoma. Other skin cancers are squamous cell carcinoma and melanoma. So how do you know if you might need to see a doctor?
How often you should see or when you should see a dermatologist is related to your personal risk factors. So having a family history of skin cancer, having a history of blistering sunburns growing up, tanning bed use all increase your risk.
Skin checks and knowing your skin is important so you can notice if something looks different.
You should have an idea of where you have moles, where you have spots, so that if something's new, you know it's new. If you do a monthly check, especially if you have the risk of developing skin cancers.
In Augusta, Isabella Moody, WJBF News Channel 6.